So welcome again. Thank you all for joining, for coming online. I know it's been a difficult, let's say, week, but probably a little bit longer than that. As you know, some of you know, as most of you know, I was away on vacation when all of the craziness went down and the borders started getting shut down, and the numbers really just skyrocketed. And it was surreal to come back to this world the way it is, where we're literally sequestered, quarantined, isolated, stuck away from everybody else. The world is just very, very different. And I want to get the right information to all of you so that you understand what it is that you can do to prevent getting caught up in the hysteria and prevent actually contracting and having severe issues come up from the condition itself. Okay. So let's jump right into it. And please, if you have any questions, just message them in the chat to me. Okay. So what we're going to do is just give a quick disclaimer, as I will be sharing this online. I'm a chiropractor, I'm a functional medicine practitioner. I offer advice on health optimization. None of this information is intended to diagnose or treat any condition. And the information provided here by me is not intended to replace the advice of your medical doctor or healthcare provider. Okay, just a quick disclaimer. So first off, what is COVID-19? What is this coronavirus? What is this issue that we're all experiencing and working to avoid becoming a big issue? So the actual strain, which we all now know as coronavirus, that's the generic name for this virus. It is actually a virus, obviously, not a retrovirus like HIV. It's not a bacteria that we know live in our microbiome. It is a virus, and that virus causes, in most cases, the coronavirus, as we've noted in the past, is one of the causes of the common cold. Now, coronavirus itself was mutated in 2001, I believe, and was actually the reason for SARS, for those of you who remember going through the SARS epidemic probably about 15 or 20 years ago, something along those lines. And what happened with SARS was severe acute respiratory syndrome, hence SARS. And we know that it was a coronavirus that was actually causing it. Now, we didn't know it as coronavirus at that time just because in the media, popular media, it just became SARS. What this virus is that COVID-19 is specifically is SARS coronavirus 2, and that is the actual name of the virus. The disease that it is causing, this is a new strain or a modified strain, and what this is actually causing is a disease that we've now called through the World Health Organization COVID-19. And what COVID-19 is literally, they took coronavirus disease and the year that it was discovered in 2019, and they plugged it together. So COVID 2019. So COVID 2019 is the disease that is caused by SARS-CoV-2 virus. This is how we can define it. This is how it is known in the medical community, okay? So this is a very important clarification. Just know what it is. It is not the Wuhan virus. It is not the Chinese Wuhan virus. It is not just coronavirus. It is SARS-CoV-2 that it causes COVID-19, okay? Now, as of the time that I'm recording this on the Microsoft Bing COVID tracker, the numbers are approximately 219,000 people are currently infected. And that number from last night has gone up by over 20,000. So clearly this thing is spreading. It is a very, very volatile condition. It is very easily spread. And that's why the WHO has called it a pandemic. Pandemics are rare. SARS was a pandemic. Ebola was a pandemic. The 1918 influenza was a pandemic. This will be the fourth one that we're getting in the last century approximately. And so these are important to know before we get into these, what's actually causing this and how it's transmitted from person to person. So how is that virus, that SARS-CoV-2, transmitted? And the number one way that it is transmitted between people is through respiratory droplets. And that's why we are actually working to keep our distance from people. Okay, doesn't matter where they are, doesn't matter who they are, sick, not sick, just for caution's sake, we want to remain a physical distance away from others. I'm not a fan of the term social distancing. As you can see, we're all on this call right now and we're being social, but we're physically distancing, not socially distancing. Social isolation is actually the number one cause of all-cause mortality in the world. And so I'm not a fan of isolating ourselves physically from anybody. What I'd like to say is physically distancing. And let's stay away from people physically so that we don't continue the trend of passing this on to other people if we are carriers or if we are infected. And let's stop that from creating more of an issue. The other way that it can be spread is through bodily fluids and physical contact. Obviously, those are all linked to the respiratory droplets. And what's interesting about this specific virus is that it is able to live on inanimate surfaces for a period of time. And that does include plastic and stainless steel, on which it can live for 72 hours. Cardboard, it can live for 24 hours. Copper for 4 hours and aerosol for 3, which is really interesting. So it's important to keep a hygienic environment around you. And if you're getting a cardboard box through a delivery, let's say an Amazon delivery, for example, keep in mind that there is a chance of transmission if that cardboard has been sneezed on, for example, within the last 24 hours. So we always want to make sure that we are avoiding and being careful and making sure that these things are not causing major issues. Okay. So great question, Sophia. Yes, aerosols are the sprays. And so with aerosol containers, it can remain within that pressure for about 3 hours. Okay. And in the actual aerosol cans. So really important to ensure that we're staying away from people for a period of time, and that 14-day incubation period is really important to keep in mind. So how does SARS-CoV-2, the coronavirus CoV-2, become the disease? So what needs to happen is initially we need to have the SARS-CoV virus, the coronavirus, enter our body more than likely through a respiratory event. So it can come in through any part of our face, mouth, nose, eyes, ears as well. Okay. And what it does is once it enters the respiratory tract, gets into the lungs, it enters the bloodstream and can go to any cell of our body. And when it goes to the cell, the way that the coronavirus enters the cell is really important in how we're actually going to eventually learn to treat this condition. The SARS-CoV-2 has little spikes on it, okay? And these are little proteins all over the surface of this virus. And these little proteins, some of which are able to fit into the receptor on certain cells called the ACE2 receptor, ACE2 receptor, also known as the angiotensin converting enzyme 2 receptor. Don't worry about the specifics, but we'll talk about the ACE2 receptor a little bit more as we go through. All you have to know is the ACE2 receptor is the one that this virus can attach to and get into people very easily and get into the cell very easily. Once it enters the cell, it's going to send out its nuclear material, which is called RNA. That's how viruses work. They send out RNA into the endoplasmic reticulum and to the ribosomes of the cell, and that's going to start producing a protein. And that protein is going to eventually kill off that cell while replicating the virus and allowing that virus to continue to grow. Okay. Now, for the vast majority of cases, about 80% of cases, the symptoms are going to be very mild. They're going to be just like the influenza, like you have a basic flu or a common cold. the vast majority of people are not going to experience major severe symptoms. About 20% of people do get those major severe symptoms, which we'll talk about, but this is essentially how the virus gets in and causes its effect internally. So what we need to know is the ACE2 enzyme is really important, and we're going to talk a little bit about that. Now, really interestingly, you would think the more ACE2 receptors your body has, the more likely you are to have the ACE2 come in and cause an issue, or to have the SARS come in and cause an issue. What's actually interesting is it's the exact opposite. It's an inverse relationship. So those people who have lots of ACE2 receptors on their cells actually have a decreased risk of severe symptoms of this condition. I'm going to show that on the next slide here. So what it says is essentially the more ACE2 receptors you have, the less chance you have of severity and fatality. Okay, so this is really, really interesting. So keep this in mind. When we're young, we have very, very high numbers of the ACE2 receptors. And when we're old, those ACE2 receptors start to decrease. So our age does have something to do with this. But there's other reasons why you would have more or less ACE2. The ACE2 receptors are greater in numbers for females than they are for males. And that's actually really important because about 70% of people that have severe symptoms of this condition are male. That's really, really important to remember, that females actually have a decreased risk of severity of symptom. But there's one more really important factor that is specifically type 2 diabetes is very strongly linked to severity of symptoms, as when you have type 2 diabetes, if you've been diagnosed with that, your ACE2 receptor levels are significantly decreased. And that means that you're at higher risk of the SARS coronavirus entering the cell and staying there. Okay, so very, very important to remember that there are comorbidities that will lead to severity of symptoms. So what we're doing for the vast majority of the people that are on this call is we're working to optimize your blood sugar. We're working to optimize your longevity. We're working to optimize your immune system so that you don't have these comorbidities leading to increased risk of the severity of these symptoms. Sound good? So really important to keep that in mind. So speaking about this, who is at the highest risk? At this point, about 2.3% of people that have been infected with the SARS coronavirus and been confirmed to have COVID-19 have actually lost their lives. It is fatal for 2.3% of people. What's interesting is that number is about 23 times greater than the basic influenza virus or the flu. So this is significantly more damaging and more severe than a basic flu would be. Yes, people do pass with the flu, but 23 times that are going to pass with this. And that's really important. So this is a really important factor to note. As well, about 79% of those with severe complications that went into severe symptoms had comorbidities, including type 2 diabetes, which I talked about, but also hypertension, fatty liver disease, gastritis, coronary artery disease or coronary heart disease, hyperlipidemia, and gallstones. So these are all comorbidities, cofactors in severe complications. The reason for these is that these conditions, all of these conditions, are actually known to increase inflammation levels, all known to increase inflammatory cytokine activity. And what these viruses are causing when they enter the cell and they break that cell down, they're actually causing a cytokine storm, a storm of inflammation. And if your body is unable to handle it because you have liver dysfunction or blood sugar imbalances or gut dysfunction, these are all reasons for why you would not be able to handle it. And that's why severity of these symptoms becomes so much worse in those specific cases. Now, really, really important to remember that 100% of people that have lost their lives had multiple comorbidities. Okay, so what we can do to ensure that we are not affected as much as possible is avoid these comorbidities. Let's get rid of these comorbidities to the best of our ability. If we become healthier, our risk of developing severe complications is significantly decreased. And that's what we do with you guys at Health Upgraded. Now, next step, what can we do to prevent getting this? We talked about social isolation, social distancing. There's a few things that each of us can do. Obviously, we want to wash our hands. I guarantee each one of us has heard this a million times, but I'm going to be the millionth one, that we need to wash our hands for about 20 seconds at a time, using soap and water where possible. Alcohol-based solutions such as Purell are a second choice always, never the first choice. And we should be washing hands with soap and water to that 20-second period of time before we wash it off. And an easy way to remember this, you can either, if you have kids, you can sing Baby Shark. That's about 20 seconds. Let's not sing Baby Shark. It's too much, Natalie. I totally agree with you. And let's keep it to Happy Birthday. And if you sing Happy Birthday twice, and you can say it's your birthday, which for Laura actually is true tomorrow. Happy birthday, Laura, tomorrow. Is really important. So let's sing Happy Birthday twice. And tomorrow, let's sing Happy Birthday to Laura. Laura's going to get a lot of happy birthdays in washrooms with people washing their hands tomorrow. Okay? So washing hands, number one, most important thing. Second thing, coughing and sneezing. I came back from my trip. My daughter had runny nose and all this fun stuff. And we were trying to make sure that she was sneezing into her sleeve, into her elbow, or into a Kleenex of some sort, and not touching her face. And then we would still find that wiped snot halfway across her cheek. But we do our best, and we try to avoid that. When we have the virus on our hands, it enters when we touch our face. We want to minimize touching our face. It's very difficult when you have a beard. Probably a little less for those who do not have as much facial hair as me. All right. Number three, we want to keep our distance from people. So we are able to go outside. This is really important. You do not have to stay inside your home. You can go outside. I've taken a couple of walks to the park with my daughter. Important to do that when you have a 2.5-year-old running around the house for about a week and a half at this point. And really important to just, when you're outside, if there's others around, just keep your distance. I've met 3 new parents over these last couple of trips, but all the time keeping that distance, so making sure to not pass anything on to anybody else. Okay. Number 4, do not share cutlery. I imagine this is pretty straightforward, but don't share food, cutlery, or other objects without washing or cleaning them. Okay. Do your best to limit sharing of anything, unless you're like with your family that you understand what's going on and everybody's pretty clean and safe. But when you're outside with others, be very, very careful and cognizant. Number 5, masks are pretty much unnecessary. They're not going to do as much as you think they are. A lot of people out there will see in the airports, we see people walking through with masks. There's certain situations where you're going to want one if you're going to be meeting with hundreds or thousands of people at a time, such as the border agents at the airport. But a lot of people don't need to have masks. And oftentimes they actually make you touch your face way more. And that's problematic because then you're touching your face and a lot of people are wearing them incorrectly, and it oftentimes is really a waste. So if you do not have symptoms, I recommend don't bother worrying about masks. Just keep your physical distance. Okay? So let's say you were to contract COVID-19 or contract the virus. If the virus did show up, what would it look like? Well, the symptoms of COVID-19 that are specific to COVID-19 are wide-ranging. There's quite a few of them. However, in about 87.9% of cases, the most common one is a fever, and that's a pretty high fever itself. That fever should be essentially over 100.4 degrees Fahrenheit, okay? That is an important factor when deciding if you think you might have it. The second most common thing is a very dry cough. It is not a phlegmy cough. A very dry cough tends to come right in the throat, but it's because the lungs have been affected in some way. Oftentimes, this is a sign of pneumonia and fluid production in the lungs, the lung cavity. And that's actually how coronavirus and the COVID-19 actually causes its effect and leads to fatality in people. It's actually causing pneumonia over time. It's an inflammatory production inside the body that leads to production of fluid, and this fluid has nowhere to go. It eventually ends up in the lungs, and that leads to a pneumonia, which then over time, for those who are unable to handle that pneumonia, will eventually lead to fatality. Okay. The next one is fatigue, is also very, very common. That obviously is not specific to this. None of these are actually very specific to it, but fatigue is very common. Sputum production in about a third of the people. Shortness of breath is a very common one, also linked to the pneumonia and the lung issues. And then the less common ones are the muscle pain, sore throat, headaches, chills, nausea, vomiting, nasal congestion, and diarrhea. What's really interesting, and there's some misinformation about this, but what's really interesting is COVID-19 infection seems to rarely cause a runny nose. Runny noses are not a sign of COVID-19, okay? Which is why I wasn't so worried about my daughter when she was wiping the snot off her face. Okay, so that's just a good sign that we're aware of what's going on, and if that is happening, it probably isn't COVID-19. So now that we know what it could be, what can we do to upgrade our immune system to make sure that these symptoms do not become severe and lead to very severe issues? Well, number one is going to be sleep. Sleep is the most important thing that any one of us can do to improve our immune system, period. If we're not getting 7 to 8 hours of sleep at night, our immune system is not given an opportunity to fight the battles that it needs to activate our vagus nerve, to actually get into that rest, digest, recovery state. And that is where a lot of issues can come up for people. So oftentimes, if we're not sleeping well, you'll notice if you're sleeping 5-6 hours a night, you're going to get a lot of issues in terms of getting sick often. And so that is no different here. We really need to improve our immune system, and sleep is a great way to do that. For those of us who are working from home, it's amazing. We're now able to not have this commute and not have to worry about things. And if our kids go to bed on time, then we have a little bit of time and we can actually go to sleep. So sleep is absolutely imperative and the top most important thing that you can do to improve your immune system. Number two, all of the vagus nerve exercises that I talk about in the book. Okay, each one of you, I believe, has a copy of the book. And if you haven't read it already, there's a ton of really great exercises in there that will help to get us into that parasympathetic, rested, digest, and recovery state. And when we're in that state, we're able to fight off the battles that we have with viruses, bacteria, etc. So we really, really need to do these exercises. Deep breathing is wonderful. Wim Hof breathing is a great way to modulate the immune system. If you haven't heard of it, read it a little bit about it in the book, and look into Wim Hof breathing and Wim Hof training exercises. I believe he's offering his courses at an actually really good price right now if you're interested in digging deeper into that. Okay. Gargling, as I've told probably every single one of you, is the best way to stimulate the vagus nerve. If you're doing it consistently, it will get you into a calm state. So gargle morning and evening, okay? Meditation is a wonderful tool as well. Really is focused on getting the breath going again and making us feel a lot better. And then cold showers, for those of us who don't have Raynaud's phenomenon and other health challenges like that, doing something along those lines with the cold shower can be very, very beneficial. The way it works, the cold showers actually stimulate that breath and get us focused on breathing deeply with our diaphragm. So this is a great tool for anybody to improve that. Great questions from a couple of people here, from Sophia and Lisa, in regards to gargling. So I highly recommend gargling with salt water always. Partially because its antibacterial, antiviral effects of the salt are great. So I'll use a little bit of, not table salt, but Himalayan is a great salt to use. And in warm water, And I recommend just keeping a glass beside your sink in the morning and in the evening when you brush your teeth. Add an extra minute to minute and a half of gargling and clearing out the phlegm at the back of the throat and the plaque that kind of builds up in the mouth. And so when we gargle, what we're actually doing is we're stimulating the muscles. If we're gargling with salt, the salt can actually break down the phlegm and the fluid at the back of our throat and open that up and get rid of where we can hold on to a lot of the virus and stuff like that as well. So yes, I highly recommend gargling with salt water. The next thing we can do is fasting. And I know I've spoken to many of my patients about it, and previously I've spoken to a lot of people about it, but fasting is really, really good at giving our immune system an opportunity to handle what's coming in. As we know, between 60 and 70% of our immune cells are actually located in the lining of our gut. And when we take on so much challenge of attacking and fighting against a virus, such as COVID-19, what's actually happening is when our immune system is decreased and depleted, we're not able to handle that. And what we need to do is improve our ability to handle that. Fasting gives our gut a break from digesting and breaking down food to allow the immune cells to focus on things that might be happening around. So I recommend something like a 16-hour time-restricted feeding on a daily basis, or you could do a 24-hour fast or a 36-hour fast. They're really great ways to just get your immune system up and give your gut a break from the digestive process, which is very energy intensive and takes a lot of work to keep up. And lastly, and this one just makes the most sense, obviously, if you're going to be eating, the diet should be clean. It's really funny to see empty shelves in the grocery stores where all of the non-perishables are gone. And sadly, the vast majority of these non-perishables are terrible options if we want to improve our immune system. So my family, my wife has been a big part of this, but my family has been eating really, really clean since we've come back to make sure that we are improving our immune system, giving ourselves the minerals, the vitamins are necessary to optimize our immune system. So salads, tons of vegetables, green, clean, and lean diet, add in some good healthy fats, but really you want to not have foods that are full of sugar, foods that are gluten containing, dairy containing, highly processed, highly preserved, negative health challenges there. And yes, Laura did speak to the fasting. Yes, I highly recommend drinking water when you are fasting, and you can even do tea and coffee, as long as the coffee doesn't have other things as well, like milk or cream. But yeah, you can definitely do tea, coffee, water, but highly recommend. You do not want to become dehydrated when you're fasting, so water is recommended. Another great question from Sophia. Vegetarian curries are a great idea. Yeah, absolutely. Vegetarian curries are perfect, and I think if we're adding a lot of the good herbs and good quality herbs into them, adding some turmeric to help with inflammation, adding oregano, which is great antiviral, stuff like that can be very helpful. In regards to almond milk, not if you're fasting, Sheelam, but almond milk generally is okay as long as it's unsweetened, because the sweetened versions have a lot of sugar in them. So unsweetened almond milk is fine, but not if you're fasting. Marie, do I recommend a 16-hour daily fast? It depends on the person. That's a great question. If you are able to handle that 16-hour fast on a daily basis, so stopping eating around 8 p.m. the day before, and 8 p.m. the day before, and starting eating at noon the next day, if you're able to handle it and your blood sugar doesn't crash, then yes, absolutely. I think fasting 16 hours a day, doing the time restricted feeding or intermittent fasting as we're calling it, yeah, that's absolutely fine. In fact, very good. And then Lisa, fermented vegetables are very helpful. And I'll talk a little bit about that, not specifically about the fermented vegetables, but why they're really good. So the next step is therapies that can be used to support our bodies against that COVID-19. Now, there was a really interesting article that came out very recently, obviously, called The Management of Coronavirus Disease 19. And it was in Chinese, but the English translation was out. And essentially it talked about the 5 things that needed to be done to optimize your ability to support yourself against COVID-19. And those were, number 1, optimizing your liver function. That's always the first thing that I look at when I'm working with any client, is to optimize liver function. Number 2 was the gut bacterial population. And Lisa, that's where the fermented vegetables come into play. So yes, absolutely, we want to optimize our gut population. And fermented vegetables are a way to do that if we're not dealing with bacterial overgrowth like SIBO or something like that. So if you've done your testing already and you know what's going on in your gut, then we can add in fermented vegetables where necessary. Number 3, optimizing our blood sugar balance. As we know, type 2 diabetes is the number 1 comorbidity in causing the issue to become more severe. And blood sugar balance and insulin balance is absolutely imperative in making sure that that is done. So we want to make sure that we're having low glycemic foods, not spiking our blood sugar with high sugary foods, and making sure to be moving all the time. What I'm doing is I'm getting on my Peloton bike as much as I can and getting my legs moving, and I'm standing right now as well, which is working out my leg muscles. So this is a great way to make sure that I'm not just sitting on my butt all day at home and not allowing that blood sugar to get used up, because I am eating and there are sugars in my food, the carbs that are there, they're needing to be broken down. And in order to do that, I need to use them. And so that's how I'm going to make sure that I improve my blood sugar balance. Increasing ACE2 receptor density is obviously something that we are not entirely sure how to do that through diet quite yet, but obviously the anti-inflammatory diet and the low blood sugar levels, like the balanced blood sugar, is imperative in making sure that those ACE2 receptors are as dense as possible. So really keep that one in mind. There are pharmacotherapies that are shown to inhibit or work on the ACE2 receptor, and we are yet to know whether or not they're helpful or not. That's where a lot of the research is. It's not entirely sure what we can do to improve the receptors from a pharmacological perspective. And then the last one was addressing stress levels. Now, this is the really interesting thing that is happening in the world. There's a lot of fear. There's a lot of worry. There's a lot of anxiety. People are traveling across borders. They don't know if the border is going to be closed. Chris, I'm pretty sure you're back home. Nope, you're still over there. No worries. Okay, so that's interesting. We'll talk about that later on. But the border is now closed. The Canadian-US border to non-essential travel is closed. So there's a lot of stress. And even when I was traveling back from my vacation, it was the same idea. We weren't sure what was going to be going on. This stress leads to increased cortisol levels, increased adrenal response, and that leads to decreased immune function. So isn't that really funny that just our stress can actually cause us to have severe complications from this? We need to work on managing our stress. Okay, the vast majority of us that are going to be exposed to this pathogen are not going to have significant health challenges. Yes, it's difficult to have to manage our kids all day, every day. Yes, it's difficult to not have the financial support of working all the time. Yes, it's difficult to be stuck in the world the way that it is right now, but everybody is in that same boat for the most part. So be really, really cognizant of that. Don't worry so much. Don't let the stress get to you. Use this as an opportunity. And one of the cool things that I learned over the last few weeks was that the Chinese word for crisis has 2 symbols. And the 2 symbols in the Chinese word for crisis, the first one means danger, and the second means opportunity. And that was really cool to me, because I think if we take this as an opportunity to allow ourselves these 2 weeks of trying to figure out what needs to be done in the house, what can we do to re-engage with our relationship? Can we spend some time learning how to cook a new meal? What can we do to make our lives better over these next 2 weeks? It really is an opportunity to reconnect, to slow down, to not let the stress get to us and just use this time to learn. So I think this is a great way to look at this challenge and think of it as a challenge. It's not something that's negative. It will pass. So very, very important to do that. Just need a sip of water here. All right. Yeah, there I go, coughing into my hand. So therapies to support against COVID-19. And this is where I'm going to talk a little bit about the supplements, the herbs, and the things that we can do as well. So number one is liver, supporting our liver. As we know, the liver function is really, really important. What the liver does in the case that we do have the infection is it's going to weather that cytokine storm, that inflammatory storm. The inflammation that's coming up is going to need to be cleaned out, and the liver does that. So in order to support the liver, there's a couple different options. Glutathione is the most important antioxidant in the body, and it's essentially how our liver functions. If we don't have good amounts of glutathione or the amino acid precursors to glutathione, then our liver isn't able to handle the cytokine storm, and we're not able to take on the challenge of positively affecting our health. So really important to keep that in mind. So glutathione, it can be liposomal glutathione, it can be glutathione from a capsule, doesn't matter. Really, if we need that liver support, that's a great tool. Now, N-acetylcysteine is one of the amino acid precursors to glutathione, and it's also known to be really good for lung function and bronchial function. So just a really great option to look into as we go through this. Okay, so liver support, we're looking at glutathione and N-acetylcysteine. There was another article that came out talking about what was needed to make sure from a gut perspective and nutrition perspective what was functioning well. And that same Chinese article that I talked about specifically said that in nutritional examination of those who had the severe symptoms of COVID-19, they had imbalance in their lactobacillus and bifidobacter levels. Okay, and that's really, really interesting, because what that means is imbalance in the gut microbiome leads to imbalance in the immune system, leads to severe symptoms. So probiotics can be very beneficial. Now, being a patient of ours here at Health Upgrade, being a patient of ours here and getting that testing done really gets you the right information of what's going on in your gut. Do you need probiotics or not? If you're working with me already, you know for a fact that we've figured out what probiotics are needed in your specific case. And so we can make recommendations to optimize the gut function. But for the general population, some probiotics can be helpful and can be beneficial depending on each person's individual case. The next thing is antioxidants and minerals. These are really, really important because the cytokines are going to create a negative inflammatory response, and that inflammatory response can lead to reactive oxygen species causing damage. And that's why we need antioxidants to help support the immune system function as well as the function of basically every other cell in our body. So vitamin A, vitamin C, vitamin E are really, really important in a vitamin perspective. Resveratrol is a wonderful antioxidant as well, usually comes from fruits like berries. And the zinc is one of the most important minerals in the balance of the immune system. Really interesting way to check if you are zinc deficient is to just look at your nails. So really interestingly, if you look at your nails, if you see little striations or little white dots, okay, the striations are little lines that are going along the nails, or if we see little white dots, then that is a sign that our bodies are deficient in zinc. And so zinc supplementation can be very beneficial in making sure that that's happening. This test literally requires looking at your fingers. So if you can do that and take a look, if you need zinc, let us know and we can definitely get you set up with a good quality zinc. The last thing that we want to look at is antiviral herbs. And obviously none of these have been tested specifically against COVID-19. We don't know for sure if these are going to be beneficial, but these ones that I'm talking about tend to be good to work against viruses. So Echinacea purpurea is one of the strongest herbs in battling any virus. And it's something that I use whenever I start to feel a bit of a scratch in my throat, a little tickle there, just saying, hey, something's going on. I will immediately take a very high dose of Echinacea purpurea, okay? Second thing is oil of oregano, which many of us are using in regards to antibacterial, antiviral issues. If there's something going on from a gut bacteria perspective from our testing, oil of oregano is a wonderful tool against viruses. So something to consider using if need be. Licorice is really, really great for this as well. There's certain products that we use that have some licorice in them, such as the GI Microbex, for those of you who may be on that one. But really wonderful natural tool to help kill off some of these viruses. And lastly, colloidal silver has been shown to have some antiviral properties. We don't want to use any of these for a long period of time. None of these should be used for months and months and months. They need to be used in rotational periods and making sure that these things are managed and not causing negative effects to the balance of gut bacteria and all the bacteria in our microbiome as well. Now, the reason I specifically say is do not use elderberry, and Lisa, I see your message there. Elderberry is fine for the flu. There's a very specific issue with elderberry in regards to COVID-19, and that is that COVID-19, as part of the cytokine storm that it creates, activates something called IL-6, interleukin 6, as its major anti-inflammatory or inflammatory cytokine. And elderberry has been shown to increase the IL-6 numbers by about 6 times. So it's very, very dangerous to be taking elderberry if you are dealing with COVID-19. So if you do get sick in the next little while, you start to feel that cough, the dry cough, the fever, things like that, highly recommend do not take elderberry, do not take anything with elderberry. Reach out if you do start to feel some symptoms, but the best thing you can do if you do start to feel them is get tested for COVID-19 by calling public health wherever you are, okay? Let them know that you're experiencing these things. They will likely send somebody home to you, depending on which country you're in. Sorry, Chris. And they will send people out to you and check on you if you're in Canada, and do it so that you do not then become a threat to transfer that to more people. So we want to be really careful about this, okay? I hope this has been informative and you've learned a ton. Obviously, you know where you can find us. You can reach out to us directly through our messaging system on the app, or if you want to message me directly, most of you have my cell number as well. Okay, so please reach out if you have any questions. But for those who are watching online, you can find us at healthupgraded.com, and you can learn more about what we do, how we work with clients to improve their overall health. Okay.